Hello, everyone, and welcome to today's webinar, COVID-19 and Dialysis Patients, Your Questions Answered. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You've joined the presentation listening with your computer's speaker system by default. If you would prefer to join over the telephone, select the arrow next to the unmute icon on the bottom of your screen in the Zoom toolbar. Select Switch to Phone Audio, and then select Phone Call and follow the prompt to dial in. By default, all participants enter the webinar with audio muted. Thank you to everyone who submitted questions by email. Please note that your exact questions may not be able to be answered directly, and we will be unable to provide medical advice for specific issues. In order to address as many questions as possible, we will have reviewed all the questions that have been submitted and will answer those of a similar nature collectively. Thank you for understanding if you do not hear your question mentioned. For those of you joining on your computer, you will have the opportunity to submit text questions to the presenters by typing them into the question pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of the presentation. In order to protect your privacy, when you ask a question, please do not use your full name or provide any other personal identifying information. Today's webinar is being recorded, and you will receive a follow-up email within 24 to 48 hours with a link for on-demand viewing. I would like to introduce our moderator for this webinar, Lydia Lauder, National Director of Programs and Public Policy at the Kidney Foundation.
Thank you, Janice, and welcome to everybody attending the webinar. Before we begin, the Kidney Foundation of Canada would like to thank our sponsors for making the 2020 Kidney Foundation webinar series possible, specifically AstraZeneca, Horizon, and Otsuka. COVID-19 is a serious health threat, and the situation is evolving daily. In these uncertain times, it's normal to feel anxious, especially for those with underlying health conditions. Talking to people you can trust and getting the information you need can help. The Kidney Foundation, in partnership with the Canadian Society of Nephrology, is proud to present this webinar, COVID-19 and Dialysis Patients, Your Questions Answered. This webinar will give you the opportunity to ask questions to some of Canada's leading nephrologists and dialysis specialists, and the content is intended for a Canadian audience. We welcome Dr. Peter Blake, who is a Professor of Medicine and former Chair of the Division of Nephrology at Western University and London Health Sciences Centre. He is Provincial Medical Director of the Ontario Renal Network, Inside Ontario Health. Dr. Pierre-Antoine Brown is the Medical Director for the Ottawa Hospital's Hemodialysis Program. Dr. Adira Levin is Head Division of Nephrology at the University of British Columbia and Consultant Nephrology at Providence Healthcare St. Paul's Hospital in Vancouver, Canada. She is the Principal Investigator on a patient-oriented network grant, CanSolve CKD. For the doctor's complete bio information, please visit our website at kidney.ca webinars. I will hand you over to Dr. Blake.
Good afternoon. First of all, I'd like to thank the Kidney Foundation for giving me this opportunity to speak to this audience. And I am so impressed at the huge number of people who have registered for this event. It's a credit to the Kidney Foundation, but it also speaks to the huge interest and the huge impact that COVID-19 is having on the kidney community. I've been asked on this slide to answer a few questions. Each one of them I could take quite a while with, but I'm going to try and hit the important points here. How has the current COVID-19 epidemic impacted dialysis patients in Canada? Well, profoundly. I'm going to divide my answer into three areas. One is at a convenience level, two is at a psychological level, and three is at a medical level. Let me pick convenience because every one of you who's on dialysis, and especially on in-center hemodialysis, will be aware of this. The hemodialysis units across the country have been disrupted. They've changed their common practices, and this can be very difficult for people who dialyze in them, and indeed for the staff who work in them. We're all creatures of habit, and change can be very challenging, and there's a lot of change going on. So now issues like what seems like endless screening, phone screening, screening at the door of the hospital, screening at the unit, masking, which Dr. Levin will talk about lately, disruption of schedules, new rules, distancing. You know what I'm talking about. Little things can be very irritating. Access to ice is an issue for many people, and some units are restricting that and upsetting people. Seems trivial, very important for some people. So a really major disruption of the routine of dialysis, and that of itself is upsetting. The second level, and Lydia referred to this, is the psychological disruption. And again, this is happening to staff, to nurses, to doctors, to everyone, to the whole general public. But of course, it must be worst of all for a patient in dialysis or any other patient in a hospital at the moment. It's a very vulnerable time for patients. It is completely normal to feel very anxious, and a lot of people obviously do. And it varies in severity. We all manage this sort of stress in different ways. Some people are frankly very fearful and anxious and say it out loud. Others bottle it up and hide it and go quiet. Others go the other way and become more outgoing almost. And deep down, there's just a whole lot of concern. And I think it's very, very normal. Some people think they're doomed to die. It's an irrational sort of thing, but I've heard all this. One that's become to my attention in the last couple of days from two patients that sort of got me thinking is that the people I know and patients I know well came to me with our conspiracy theories, which are very common at the moment on social media. They said to me, "This is all a scam, Dr. Blake, isn't it? It's a conspiracy." And, there's various theories like that out there. And these are people who I have a lot of respect for, and I think, wow, why did they believe that? But of course, people believe these things because they're scared and anxious. And it isn't a conspiracy theory in my personal view. I don't think most of us think it's a conspiracy, but it's the sort of information that is out there and disturbs patients, and I'm sure many of you see it on social media. So it is normal to be psychologically upset at the moment, to not be yourself, to be very anxious. The third area is the medical area. And thankfully, this so far has been a big nothing for most patients. The vast majority of our dialysis patients have not had any effect on their health. We are very fortunate in Canada compared to our neighbors to the south or to some of the countries in Europe. So far, we are having lower rates of COVID-19 in the general population, relatively lower numbers in hospital, and critically important to this group, very low numbers on dialysis. Very, very few people, way less than 1% of the patients are getting this virus. Can I say that will never change? No. But at the moment, the risk is very, very small. You're still much more likely if you're on dialysis to get an infection in your catheter or whatever than to get COVID virus. But I don't mean to be complacent about it. The second question is, what can you do to prevent the spread of infection? Well, you know some of the answer to that. You hear it endlessly on the television. You have to keep your distance, observe the physical distancing, or social distancing as it's sometimes called. And I think it's critically important for people on dialysis to do that. And of course, I'd go further because people on dialysis are more vulnerable. Let's be frank about it. If you get COVID virus and you're on dialysis, and especially if you have other medical conditions on top of that, you are more vulnerable. So I would say my advice would be to, and I think you're hearing this from everyone, is stay at home other than when you're coming into your dialysis treatment. Stay at home and stay away from people as much as you can. That's very hard at times. We're social creatures. It's lonely, but I think it's very important to protect yourself by taking these sorts of measures. I want to suggest a few other things. the screening that you've been facing if you're an in-center hemodialysis patient can be exhausting. I've heard patients get irritated and get angry and say, they asked me that 2 minutes ago at the door of the hospital, and they asked me on the phone last night, and now they're asking me again. You know, I understand it. We go through it all as well as doctors and nurses. It's tedious, but I think it's vital. And I'd go further and tell you another anecdote. And this is not, the doctors and nurses and patients have all done this. People aren't always frank when they're screened. They don't always tell the whole truth because they're scared. So at least in Ontario, we've had one small outbreak in a dialysis unit related to a nurse who, with the best intentions, minimized a sore throat and actually turned out to have COVID virus. She kept on working. And in at least 2 other places, patients have played down symptoms that they had. They admitted later they had them, and they got through the screening and caused an issue. So I would plead to everybody to be honest. Everyone is frightened. We're all in denial at various times. Others of us are a bit neurotic and mention every symptom. But please, for your own sake, tell the screeners at the doors, don't make it hard for them. And understand that however tedious you find it, imagine how tedious it is for them to ask the same questions repeatedly. At the local and provincial level, what has happened? Lots has happened. At your own hospital level, there's endless conversations. Decisions are changing every day. I'm going to leave it to Dr. Levin to talk about the big issues of masking and screening and swabbing and distinguish between those. Province-wide, there's an effort being made to share practices, best practices between programs. Best practices keep changing. And what we try to do across the country is share with each other what's happening. And if one center hears that 2 or 3 other centers are doing something that sounds sensible and has some evidence, they'll also implement it. So that's a very important process. But your hospitals are dealing all the time with infectious diseases, the dialysis units, infectious diseases, the hospital leadership to address this. I've basically already answered the last question. What can you do to promote physical distancing? I've already addressed that. But let me say lastly a bit about the dialysis schedule. Some of you will have your dialysis schedule altered for various reasons. Some units are isolating an area in the unit in case of COVID infection to put infected patients or suspected patients. And so they need to move people into other areas of the unit. And in some cases, they need to move people's shift, say from the morning shift to the evening shift. And of course, this is very hard on people. And we try to do that in a sensitive manner so that it's people who are more flexible, perhaps, who are less dependent on some form of transport or other. But please be patient. It's temporary I hope in most cases, and it is necessary. In some units where there's nursing shortages, there's even been a need to go for some people to twice-a-week dialysis. Some patients may like that, but obviously we wouldn't do it if it wasn't safe. There are some people who can manage for a short period of time with that. Please understand if your schedule is disrupted in that way. So to sum up, I'm just going to say it's a very difficult time. We all appreciate it. We're all going through it. It's much harder if you're a patient. The sense of vulnerability is inevitably greater. It's normal to be anxious. The nurses and doctors are anxious too. They're keeping a distance too. But please be patient and do your best. And let's hope we can get through all this together. Thank you.
Thanks, Peter. Can you hear me, Lydia?
We can hear you loud and clear.
Great. So again, my thanks to the Kidney Foundation, the CSN, and most of all to all of you for making time to listen, because I think the more that we share both our fears and our knowledge, the stronger we come together as a community. And I think I'll just echo what Dr. Blake said, is that we've been, because I think of all the things that all of us and as a community, the patients, the nurses, the doctors, the administrators have done, we haven't seen a large amount of COVID in the dialysis population, be that the hemodialysis, the peritoneal dialysis population, and even the transplant population. So my job is to answer these three questions and hopefully clarify some things. So what's the difference between screening and swabbing? Because sometimes we get mixed up because we use them casually. So screening are all those questions that Peter was talking about that you get asked. And in every unit and before every visit that has to be done in person, or even when people are phoning you for your virtual visit because you're not coming in, they will ask you a set of questions. And those questions are things that help us to decide whether or not you have possible or probable symptoms of COVID, which would then allow us to do a swab. And the swab is how you diagnose COVID. So I can tell you that in our province, we've done over 600 swabs in 2,700 hemodialysis patients based on screening, of which 4 have been positive. So even if you get swabbed, it's just because you've answered yes, and we're being very, very cautious and lenient in the questions and in interpreting the answers. As Peter says, the more honest you can be, the better it is, because it helps us to understand the disease. So the swabbing is the swab through the nose or the back of the throat, where they take a swab just like they do when you have looking for the flu, and it gets sent to the laboratory. And in different laboratories, they're able to process it in 4 hours or 3 days or 24 hours. And I think all of the provinces are revving up their swabbing, their reporting abilities, so that they can be processed more and more. You will have heard of shortages of the swabbing material. I think that is slowly and more rapidly getting fixed. So that shouldn't be a rate limiting step anymore. It was at the beginning. But swabbing is how we diagnose, and screen is how we decide whether or not you're what we call a person under investigation, which would be because you have suspicious symptoms. That then leads to a swab, and while you wait for the swab, you are a person under investigation, or then if you are positive, you become COVID positive. So the purpose of personal protective equipment, 3 initials that we never used to think we would use so clearly. So now everybody knows what a PPE is. What is personal protective equipment? Technically, it's anything that protects you from contact and droplet and airborne things. And in this situation of COVID, it's gloves, gowns, a surgical mask, and eye protection. That's what people should be wearing when you are caring for or in contact with people who have or are suspected of having COVID. Now, you'll know that Teresa Tam, our federal health officer, and various other provinces have talked about it's okay to wear a mask. A surgical mask or a cloth mask, and what will it do for you? Well, if you sneeze, it'll stop, it'll help to protect a little bit, depending on the quality of the mask. It certainly makes people feel safer, and there's no reason not to do that. But if you're not sick in any way, it's not really helping anything. I think that in the dialysis unit, you will see that everyone, because we cannot physically distance, and because we cannot know who is and isn't COVID positive, the nurses and the doctors are wearing protective equipment. And the patients are wearing masks, usually if they have a line, like they always did, or if they feel more comfortable. We have always used universal precautions in all dialysis units around the country, which is sterile technique and washing hands between patients and procedures, and gloves and visors in most cases because we're handling bloods. So I think that the change that you see is in the distancing that we have and in who's wearing what at all times. And I think all of us apologize and feel bad that you can't see us smile, nor can we see you smile. But because we're wearing a mask, but we're trying to work out ways in different places to be able to still have real conversations with you. So whether that's by iPad or by telephone, but ways that we can still continue to deliver care, even if it's virtually, to keep everyone safe. Remember that the reason you're seeing less people in the dialysis unit, and some of you will, and all the equipment, is to limit the exposure any of us has to anyone else, because that's how you limit the spread of the virus. So my third question is about dialysis transportation services, and this is different in different provinces. All of the people that help you come to dialysis, if it's your families, that's one thing, but if it's services, and in British Columbia we called it Handy Dart, and in other places there's Medi Dart, all of those people have been briefed with respect to how to clean and disinfect the buses that you're on, to limit the number of people that are on the buses to 1 for the small buses and 2 for the big buses. And the drivers are being taught about protective equipment and where they have to help you off or on to the bus and have to therefore touch you or undo your wheelchair or whatever it is. They're being taught how to do that. They're very dedicated to bringing you to and from dialysis in a safe way, but they're also afraid that they will either, they don't know that you are or aren't infected, and it's not their right to know. But as we go back, Peter told you, and I'll tell you as well, very few of you have yet gotten COVID, so that's great. They're trying to protect other people on the bus and themselves, and so they're trying the best they can to make sure that you get to and from dialysis safely. I think each province is discussing with their drivers to the best of the ability how to do this. And so you may find, as well as all the other changes, some disruptions to the schedule or how. I know in my province, we've asked people that where possible, their families take them to dialysis. A, because people aren't working anymore, and B, because it just reduces the load and the stress on the drivers. So I think I'll stop there and hand it over to Dr. Brown.
And thank you very much. I also want to thank the Kidney Foundation, the CSN, and all of you for attending. And I'll echo Dr. Levin and Dr. Blake's comment that despite this terrible pandemic, we've been fairly lucky in Canada. I think that all of us, all Canadians, understand the necessary pain of this social distancing and all these changes in our daily lives and things that we take for granted, like going to the grocery store easily. But ultimately, I think it also reminds all of us that we're very lucky to be Canadians, that we have government and people around us that care about all of us, and that despite these challenging times, all of us are still receiving good care. So with that in mind, I'll answer a few questions that pertain to clinics and home dialysis. And the first one is, are there any changes that should be made to the treatment for home dialysis patients? And that's perhaps one of the rare areas where things can be similar to normal, in the sense that most patients will be able to still undergo their regular treatments without changes. So far, we haven't heard of any supply concerns or disruption in supplies. So patients can rest assured you can continue to do your normal prescription and your normal dialysis. Some of you that get help from a community nurse or community worker may see some changes and disruption because of personnel that might need to take some time off to protect you from infection. And in some rare cases, prescriptions will have to be altered if there's no one from your circle and your family that can assist you. One of the big concerns that I've heard, is the shortage of hand sanitizer across the country and of procedure masks. And of course, all of you that do dialysis at home are concerned about this, and so are we. At the end of the day, though, the alternative of very good hand sanitation with soap and water, while a little bit less convenient than hand sanitizer, is very, very safe and will help you protect yourself. And while we normally recommend wearing a procedure mask when you prepare to do your treatments, it's also acceptable to not wear one if you can't get one, or to wear one that you've made yourself. Of course, these are not ideal situation, but it's better at this time than no mask itself. In terms of deliveries, you may have noticed that, at least for some of us in our program, the supplies are still delivered, but delivery persons may not be allowed to enter your home. And of course, some of you are not able to lift heavy boxes, for those of you on peritoneal dialysis. And in most circumstances, you can have help from a friendly neighbor. Obviously, you want to promote social distancing, but it's acceptable to get a bit of help for a few minutes if you need big, heavy boxes to be brought in your house. And then finally, you probably have noticed that most of your appointments, your routine appointments with the dialysis clinic, have been converted either by phone visits or video visits. And most programs have been encouraged to defer any routine tests that are not essential to your current well-being. And while they're important, they can be deferred for a few months when things improve. So you may notice that your dialysis program has deferred or pushed back some of your tests. And again, rest assured that when they do that because they know that they can safely do so until things normalize a bit. If you've been asked to go and continue to do some routine blood tests, it's also important to attend. So I'll answer a bit bullet number 4 as it pertains to clinic patients and also dialysis patients. So if you've been asked to continue attending for your blood tests, it's because it's very important for your health. And again, rest assured that all the labs, whether they be in the community hospital and community clinics, have taken measures. They'll screen patients at the door. There's a lot less patients going because all routine testing and screening has been deferred. And so in the world of nephrology, we do depend on some of your blood tests. And for some patients, it's important to continue getting those tests so we can ensure your well-being and monitor your therapy adequately. In terms of access to medications, which in the second bullet, so far, so good. We haven't heard or seen major shortages of important medications. And while some medications are routinely under shortages, there's nothing that's new or changed with the current pandemic. You will notice that many community pharmacies have decided to switch to dispensing only 30 days worth of medication at a time rather than your usual quantity. But again, that's just to make sure that everybody gets access to their medication. And while it's a bit inconvenient, it's again a short-term pain for a long-term gain. In terms of outpatient kidney clinics, I myself and most of my colleagues across the country have switched the vast majority of our visits to video or telephone visits. I've tried to defer some appointments, but since we do not know exactly when things are going to get back, quote, to normal, unquote, I've also continued to phone in or do video visits for some patients so that we don't create too much of a backlog. And so most of you in kidney clinics will probably expect a virtual visit. There are some patients that still need to come in. They have complicated disease. They need to be examined or seen in person. And again, the kidney clinics have really minimized the amount of people that are working, so we can easily promote social distancing, even if we, in rare circumstances, have to see you in person. And finally, I'll address very briefly kidney transplantation, understanding that there might be a more detailed webinar in the future regarding kidney transplantation. But for now, in most programs, and although there's some variation across the country, kidney transplant surgeries are on hold. And there's many reasons for that, but I think the most important one that you need to realize is that after a transplant surgery, in the few weeks and months immediately following the surgery, patients receive high doses of immunosuppressive medication to prevent rejection. But those same medications, of course, would increase greatly your susceptibility to acquiring the virus. And so in the risks and balance to protect our patients, Most transplant surgeries have been put on hold. Now, in some cases where it's medically urgent and necessary, or for those patients who have very high level of antibodies, there are some surgeries that will still go ahead. And of course, this will be reassessed and revisited as soon as it's safe to do so. And so that's pretty much what I had to say to answer those questions here. So I'll return it to Lydia for questions.
Thank you very much to all our panelists, and we've certainly had quite a few questions come through as the presentations have been being presented. We also had a lot of questions prior to the webinar, and so we're going to do our best to address all your concerns and questions. However, we do apologise if we cannot get to all of them. There have been a number of questions that are similar in nature, so I'll be trying to group those together so they can be answered all at once. But we're seeing quite a trend about the masks and protective equipment. There seems to be a lot of questions about wearing masks and protective equipment, both in the community and for people attending dialysis. So I was wondering if I can refer back to Dr. Levin to speak a little bit more broadly about wearing masks in a dialysis unit. Is it acceptable to wear homemade masks? Is it acceptable to have hospital grade masks? And whether you could just expand on particularly the masks a little bit for us.
Yeah, so thanks. And yeah, it's very confusing, and I appreciate the confusion because I just went to the UK, United Kingdom website, and they've just recommended as of this morning that everyone in a dialysis unit wears a mask, irrespective of symptoms. And yet that is not our current recommendation in Canada. Because the recommendation is those little surgical masks are for people who have symptoms or suspected of, or if you're in a place where you cannot avoid cohorting. I think if supply is not an issue, there probably is no reason not to wear a mask if you can tolerate it in the dialysis unit. But again, I go back to the evidence, if you will, and despite the fact that we have not been wearing masks routinely in all dialysis patients in the dialysis unit, we have a very low rate in Canada. So it seems that all the other things we're doing are working very well. That being said, if people feel more comfortable, as Dr. Blake was saying, a lot of this is about your relieving your own anxiety and perhaps doing something that is in no way detrimental to anyone else. So there's no harm in wearing a mask. And if it makes you feel better and your people around you feel better, then go ahead. You know, in many places, well, in the US, it's mandatory to wear a mask when you go outside. In China, it is still mandatory to wear a mask when you go outside. We haven't quite got there in Canada yet, based a little bit on our low rates, but I think this is something that each unit may have a different policy depending on their experience or the provincial risks that are done by their public health officer. So sorry, it's long-winded because it isn't a straight answer. Not everyone can tolerate wearing a mask. Some people have a lot of difficulty. So making it mandatory would be also not kind to them. So especially in the absence of any data that suggests that asymptomatic people would benefit from it. So I'll stop. Is that okay?
Well, can I make a comment, Adira? I mean, I agree with everything you've said, but we're noticing in Ontario increasing number of units, regardless of evidence of any quality, are mandating that everybody wears masks on dialysis. They're doing it because the doctor and the nurses, and I think it's hardest for the nurses, they're scared that they're in close to the patients. They have to hook them up to put them on or needle the fistula or whatever. And they feel very vulnerable. And so sometimes, you know, we don't know. The evidence keeps changing and there's no one certain, and it's a new disease. And so,
and as you said, you know, and everyone has different reasons for it. So, you know, would it be easier to just say everyone wear a mask? Yes, it would. If you see in your unit that that not everyone is, it's because of that that A, can't tolerate it, or B, there's someone decided there's no data. But if everyone feels better wearing a mask, nobody would stop you. And so to your point, Peter.
I think if I was in dialysis, I'd wear a mask. But if someone said to me, what evidence have you got? I don't think I'd have much, but I'd say, well, I think I would just.
Fair enough.
Thank you. And I guess just following on from those questions, there's been a number of questions about staff and patients in dialysis units being tested and or treated for COVID. And people are just wondering what will be the procedures if patients or staff show a positive test, and what measures are being taken to isolate patients who do test positive?
So that's a great question. So if you're not sick and you test positive, you will be dialyzing elsewhere. That's where Peter was. Your schedule will likely change. In different places they'll do different things. You'll either come to the last shift or be dialyzed in an isolated room if possible. This is especially pertinent to people dialyzing in community units who may have to change units if that unit doesn't allow you to be isolated. And then all of the precautions that we talked about. Again, I think, Peter, the numbers in Ontario is 26 out of 12,000, and and in BC it's 4 out of 2,700. So it's not large numbers, and where people are well enough to stay home because the symptoms are atypical, they do so. And where they're hospitalized, then what happens is they are not dialyzed in the unit, they're dialyzed off unit, where that is possible, given, again, the local circumstance. So there's a lot of thought gone into how to keep the rest of the unit safe in the event that you have a COVID positive patient.
Mm-hmm. Thank you very much. And now a question for Dr. Brown. It's very frustrating that most pharmacies are restricting our treatment refills to 1 month only. It's also more expensive as they're charged dispensing fees every month instead of once every 3 months. Is there any chance of having this 1 month pharmacy policy revisited?
Mm-hmm. So I definitely understand and share a concern, having recently refilled a prescription myself. And so I think that for the greater good, it is prudent to try to keep a supply of medications in the pharmacy so that everybody does have access should the supply chains suddenly change. And so I think by far and large, it is reasonable. And that being said, if your financial circumstances are such that it's putting a big pressure on you, I think it's important to discuss it with your community pharmacist and say, look, I understand why you're doing this, but you're also putting me in a situation where I have to choose between medications and maybe something else essential. Understand that a lot of us are living on very restricted incomes, and especially in these times where a lot of people have lost their employment because of the pandemic. So while I think overall it's a very reasonable policy across the board, again, unique circumstances are such that you should advocate for yourself. And I would suspect and hope that most community pharmacists would consider your requests.
Thank you. And I've just got a general question here. Should patients be changing their clothing immediately when returning home from their hemodialysis treatment?
It's a great question. The doctors and nurses are. Seriously, so perhaps that isn't, I don't think that we've overtly recommended it, but actually, why not?
I've heard some people, experts, again, I'm always never sure about experts, but how can you be in such a new disease? But they say that this virus does not last any significant length of time on cloth surfaces like clothing. Right. But perhaps on metal or hard surfaces like jewelry or belts, I suppose. So I like Dr. Levin, I certainly go home and have a shower, take clothes off and change them. I have no choice. I'm not given any choice in the matter when I get home. But but I think it's a good idea. We don't know, but go on the side of safety.
Right.
Great, thank you very much. And a general question for dialysis patients and for CKD patients. Are CKD and dialysis patients subject to more severe health effects from the COVID-19 virus than the general population? And if so, in what way?
So I think that's a very, it's an excellent question. It's a very challenging question, again, because we unfortunately don't have all the answers yet. We do know, though, that for this virus, what seems to be the biggest driver of how severely you'll become ill with this virus is mostly age and other health ailments. So I think, above all, not to discount the impact of having kidney disease, but it's mostly driven by age, and if you have multiple other illnesses such as high blood pressure and diabetes and heart disease and kidney disease. I don't think that we've seen enough infection, especially in dialysis patients, to see that they'll be more or less severely affected than other patients just because of their age and other health conditions.
Yeah, and I guess just for what it's worth, of the 4 people in BC that are affected, 3 of them recovered. So, but
I might make a comment too here. If you from this in Ontario, a very, very small number of people have died with this who are on dialysis. The majority of them had another hit against them. They were in long-term care homes, and that's a pretty tough mix at the moment, to be in a long-term care home where we've learned in the last few weeks how practices aren't ideal. And so if you're both on dialysis and in a long-term care home, you have the vulnerability and the ease of getting the infection, and you're often very frail, and you're often quite elderly, and you often have, as Pierre said, a number of other diseases. So these people are really vulnerable. I think for a dialysis patient who's relatively well, the risk is much, much lower. It's not zero. It's not zero for anyone, but it's very, I think it is very low to very low if you're a relatively healthy dialysis patient.
that's a good point. And with CKD, I saw there are some questions about ACEs and ARBs and chronic kidney disease patients, because many of our patients, including dialysis patients, are on those. So the current recommendations from the cardiac and all the people that order these medicines, because there's some biological reason why being on those medicines might be good for the virus to grow. Just I'm being very Reader's Digest-y about this, or help to propagate it. The reality is that it's an essential medicine, and there's nothing clinically to suggest that people do worse by being on those medicines. So we're encouraging people to stay on them, but use your sick day rules like you would for anything else. And if you do get unwell for any reason, that would be a reason to stop them. So I think it's important to stay on the medicines that your doctors prescribe for you. They will let you know in the virtual visit or otherwise which ones to stop or hold.
I think there's some.
I mentioned ice when I was talking earlier, and because I remembered it in our unit where I work being a bit of an issue for some people, and somebody has said, is there really a reason to stop the ice? I get headaches every treatment now, and it helps with cramps, and I really miss it. And one of the features of being in dialysis for many people is they have a real thirst during dialysis, and often ice gives them enormous relief. We all know that. It's we see it, and some people it isn't a big issue at all. It's a non-issue, but for some it's a very big issue. So, the person is asking, is this really necessary? And I don't know, I'm a bit of a softie about this, but the rules are the rules, and I've got to follow them as well as everyone else. So they're saying that the amount of traffic to and fro in the unit from between the nurses and the patients is increased by this constant coming back and forth with ice. I don't know if every unit feels that way about it. And I do know that for a couple of patients in every unit, it's a really big issue. So maybe there's ways around it, but at the moment there's so much anxiety and so much fear that people are making all sorts of rules to minimize physical contact and proximity between staff and patients.
And movement, right? I think that,
And
but
movement.
if you could bring a thermos with little ice cubes in it to the unit, that would work.
Another one in our unit that caused upset is curtains. Now, maybe some units would never allow this in the first place, but there are some people who come into dialysis, pull their curtains around so they can have a sleep. And that's not supposed to happen because the nurses can't see the patient. And in theory, the patient could go pass out completely and nobody would know for 5 minutes or 10 minutes. So this has been discontinued lately. And for 2 or 3 people, it's the biggest issue around at the moment. So, you know, it's everyone has these trigger points that are a big deal for them. And it's easy for me to say, be patient, and it's not a big deal. But I recognize for some people, this is very disruptive.
Thank you very much. And now to Dr. Brown. Are there any emotional supports available to dialysis patients to help them cope with the psychological issues they're facing? And are social workers still working and available?
Right. So excellent question. I can answer from our program, and I think many programs are very similar. So yes, our social workers are still working. They are working remotely, meaning they're mostly at home, but they have been doing their important work in the units. They've been reachable. They've been calling back patients and doing a virtual video visits if need be. And they can still help to provide that very important emotional support. The other thing you might have noticed is that a lot of public health units have put up also some help for stress and for mental health. As my colleagues alluded to earlier, this is a very challenging time, very stressful time for all of us, but especially patients who, by virtue of their illness, have to go back and forth to the hospital, even though they prefer to avoid it, or need to receive nurses from the community to help them with their treatments. And so it's anxiety generating, but all of our staff are still working. Some of our staff have had to take time off because they've themselves been sick, but and so you might see a bit of a delay to get an answer, but by far and large, the programs are operating as they are, and that support is there as well.
I might add something. Well, maybe the Kidney Foundation might have something to say in this. They have a lot of support groups that it varies from center to center how active they are, but maybe Lydia, do you want to?
Absolutely. Yeah, absolutely. And the Kidney Foundation of Canada is committed to supporting patients at all times, including at the moment with the high stress levels of a lot of people experiencing these COVID times as well. And so we're very pleased to support patients with peer support programs, both online and one-on-one via phone calls. We are running virtual support groups as well. There is the opportunity to speak to people undergoing similar circumstances and have a talk to them. It's not just open to patients, it's also open to their significant others and caregivers, so those supports are available. There are a number of resources in the community that we've identified, and at the provincial and branch level we'd be more than pleased to speak to you about what those local supports are in place. So you know, feel free to contact us and we can get you in touch with those supports and with those services that are available in your local community.
I might add also that perhaps sometimes other patients can be a huge help to people in this period of time. Nobody understands better than one patient to another. Problem, of course, is physical and distancing. I do know that there are, you know, informal social media groups. That's usually younger people. Not everybody's so adept at social media as they get older, but they have been helpful to some patients. But, you know, if you know the people in your dialysis unit, and sometimes a phone call, you know, you may not feel you're trained to do this, but sometimes it's just a phone call can help people. So many people feel very isolated at the moment with no one to talk to about it. And doctors and nurses and even social workers, it's a little harder, you know, they're now going to be by phone or they're going to be 6 feet away. But if there's I think lift the phone and talk to people. And if there's people you know well that you think are struggling, and just talking, you don't have to solve their problems, just talk to them.
Thank you very much. And Dr. Blade, I'll address these questions to you. These are from home dialysis patients. And there are a few further questions to the dialysis deliveries, such as getting masks and gloves and sanitizers, and support for caregivers who help out with the dialysis procedures and not being able to get masks. And so there's a few concerns about those. And we just wanted to find out what alternatives are there if those products are not available to home patients at the moment.
Well, this has been a problem across the country. I think there's a number of things you've mentioned. Deliveries, I think, have generally gone okay. There's one or two cases where a delivery driver, at least in this province in Ontario, refused to bring supplies into the patient's house because they'd heard the patient was ill, and it was all rumor and the usual sort of stuff, and the patient was not ill and didn't have COVID virus, and it got sorted out. It's important for the patients, if they're concerned about illness, to call the home dialysis unit, and if there's a serious issue, the home dialysis unit can coordinate with the driver, and the driver can sometimes make an arrangement to leave the supplies, you know, at a close by site or whatever. So communicate if you feel you're unwell, but generally that's gone well. But obviously some drivers get worried. There has been a shortage of hand sanitizers, as you all know. It's not just for people in dialysis. Soap and water is the best alternative there. Masks you heard about already from Pierre, and you know, different programs have different policies. Some don't mandate the use of masks at all. Some will, so they'll say, you know, you don't need one. Others will say you reuse carefully. So it's not an absolutely critical issue, but it's obviously worrisome if you're used to having a mask. There's no shortage of the regular supplies. There's no shortage if you're on peritoneal of the solutions. There's no shortage of dialyzers if you're on hemodialysis. Another issue that's arisen is some people, as you know, who do peritoneal dialysis get assistance, and that's been alluded to, and Pierre addressed that already. But you know, could they not, if they all got sick, what would happen? I mean, that hasn't happened. We're not dealing with that degree of a problem so far, but there is, as Pierre said, sometimes changing in the staff. People are getting ill. And remember, it doesn't mean that they have COVID virus. People get symptoms and they're pending getting screened, swabbed, they go off work for a while. So you may be getting changes like that. What would happen if there was a real shortage of supplies? That's been talked about, a real shortage of helpers. And if you had no one to do your dialysis for you and no family member who could take it up, the nurses in the dialysis home unit would have been working on this and have plans. You won't be left to just not dialyze. I think we can give that commitment. But each unit is working out its own approaches to how it would deal with that sort of situation.
Thank you very much. And then we've had a few questions come in from people who are still working and who are on dialysis. Some work in cubicle environment offices like government jobs. Others are working in long-term care homes. And the theme of these questions is when people are allowed to go back to work, they're concerned about being exposed to potential asymptomatic colleagues. Should people work from home? Should they work until a vaccine is available? Or are there any other precautions you could suggest for people who are still on dialysis and managing work?
Wow, that's a hard one.
That's why I gave it to the experts.
So I think I'll start, and I think there isn't a right answer. I think that the physical distancing will continue for quite a while. And even when we're, quote, allowed back to work, it will still need to continue with the physical distancing and no water cooling and no shared lunch rooms and things like that. So, I mean, I guess that would be how I might approach that. So I don't think that you will be alone as a dialysis patient needing, you'll be constrained by all the same other things in as much as dialysis patients are still considered more vulnerable. If you can do more of your work at home or when less people are around, and I know some employers have been very good about letting people come earlier or come later to work so there are less people around, or have an abbreviated work day. So maybe those are things that you can talk about with your employer, but I would imagine that ongoing precautions are going to be with us for quite a while. I was speaking to some colleagues in China, and they are nowhere near normal, and they've had no new cases in a while, but they are nowhere near normal back to work. So I think we're here for a little while yet. I don't know, Peter or Pierre, if you have anything else to add.
Yeah, I completely agree. I think that going back to quote normal will not be the normal we knew before the pandemic. That normal is probably many, many, many months away. I think in the near future, when the social distancing rules relax a bit, there'll still be a lot of social distancing that'll be needed to avoid a flare-up of this. And so I would expect fully that most employers and that can allow their employees to continue working and being productive from home will be asked and encouraged to do so. I think that ultimately we all have to do our part, and I don't see things opening up and tomorrow morning, unfortunately, going back to normal. So, and as long as you can be productive and do your work and you have a reasonable employer, I think it'll be the norm. It'll be the norm for a while, and it won't be the norm. And when it's not the norm, it's because we're going to have enough immunity in the population, hopefully through an effective vaccine, that it'll be safe for everyone to resume quote unquote normal.
Right.
Maybe I'll make a comment. The first part of the question got me thinking a bit. If we've generally said to our patients in dialysis, don't go to work. Now, obviously, if you can work from home, that's fine. You can work from an office and you can really feel that you can keep a good distance, fair enough. But it is a little bit of a risk because, as we've said, kidney dialysis patients are a bit more vulnerable. It would also depend to me on your general health. If I had other health issues in addition to kidney failure, I'd be reluctant to go out to work at the moment. But it's a value judgment for everybody, and life is never without risks. But still, I would be cautious about it unless I really felt protected. And I was intrigued by the bit of the question that said I work in a long-term care home. Yeah. Well, if my job was as a care worker in a long-time care home and I was on dialysis, I wouldn't work. But if I was sitting in an office where I could, do the accounts or something, or answer the phone, that would be different maybe. So it's a very big deal to tell someone to give up work. On the other hand, I would be cautious about putting myself at any risk. It's one thing if you're a 25-year-old healthy person, or even a 50-year-old healthy person. It's another if you're 50 years of age and on dialysis and have diabetes. Be careful.
And I guess just to add, like, if you are going to go into work because that's the only place you can go, you would wipe down all the surfaces when you get there. No matter what the cleaner did, when you sit down at your cubicle, you would wipe all your metal and other surfaces as best you could. And a little thing that I learned, which I think everybody knows, but I'll repeat it here. When you are cleaning or disinfecting, don't use a spray bottle. Spray into the cloth, or use a pre-soaked wipe and wipe with that. Creating aerosol is not good because it actually spreads things. So you need to wipe things down with pre-soaked things, not spray bottle stuff. So that was a tidbit that I learned from our infectious disease guys, which I did not know before, so I thought I'd share.
Thank you very much. And, this is new territory for everybody, and we appreciate your thoughtful responses. And just further to those, just to expand on those, I know that a number of our branches have been getting a few questions from patients who are working in jobs such as working in grocery stores, and wondering whether they should take any extra precautions if they are working in those type of jobs in transport or groceries work.
I guess in the absence of any evidence, that's where I would say wear gloves and a mask when you're going to those places like that. have a lot of traffic and a lot of different people moving in and out. And what you're trying to do is limit your circle of people who you don't know who you're exposed to. And so if that's the place that you work and you need to work there, then just be as safe as you possibly can. And in that case, I would suggest, as I said, mask and gloves.
I think if I was working as a cashier in a supermarket at the moment, I would request to be moved to, and I was on kidney dialysis, I think I would ask to be moved to some other back office role, if at all possible. Most employers would understand, I think, but maybe I'm naive about that, but I would worry a bit. I notice now of course, there's these perspex barriers up, which, you know, in almost all the supermarkets, but yeah, I'd be
great
cautious.
questions, and I think everyone has different kinds of employers. So yeah, if you can't move, then be as safe as you can.
And now I've had a question a couple of times that has been given to us prior to the webinar in regards to pets. And, you know, there's been a few questions about dialysis patients having pets in general, or whether their pets are carrying COVID, and what the general message is about having pets and the risk of those pets carrying COVID to patients.
Oh, we forgot to get a veterinarian on.
Oh, that's a tough one. So I guess I'll go for myself. I can tell you for very poor evidence out there what I've done. So I have a lovely dog who's very active. She's young and still wants a lot of attention. So we've not isolated her in the sense that she lives with us, of course, but we don't let her play with other dogs on walks or at the park. There are some reports, although, you know, again, the evidence is very low level. There are some reports of animals contracting the virus. There's no clear understanding as to whether or not they can transmit it, but I think that at these uncertain times, it's best to be safe. And so I think that it's safe for you to have your pets with you, but again, you have to limit your pet's social circle just as much as you're limiting yours. I think that's the best advice that we can give right now.
Right.
Great. I'll keep my cat inside for sure. And we've just going back to the food theme, we've had quite a few questions about going out to takeout restaurants or drive-through restaurants, whether that's safe. And also we're just going to revisit the ice question, which was very, very popular, Dr. Blake, whether it's safe to eat and drink in dialysis units.
I'll do the eat and drink one. I mean, something that dialysis units all have different policies on even before COVID. There is evidence that eating and drinking, eating particularly on dialysis, may actually make the dialysis a little more unstable, little more likely to drop your blood pressure. And so some units have always limited it greatly or banned it, and others are a bit more liberal about it. Now, of course, the additional factor is just the general traffic back and forth, and so they're generally, most of my impression is most dialysis units don't want people eating or drinking at the moment, and they don't want visitors and bringing food into them. Or that's my experience. It's yeah. Whether it's really justified, nobody's done a study on it. And I hear that the ice is such a big issue, even bigger than I thought at the beginning of this today. I don't have a final answer. There's no proof that ice is going to transmit the disease, but it's, as Dr. Levin said, it's the going back and forth. I think the idea of bringing it in a thermos flask might be a compromise solution, but you better talk to your dialysis.
Yeah, I think we have to separate the reason for the no ice and tea and biscuits and stuff is so that people aren't moving back and forth into common areas on a regular basis and creating traffic. So I don't see why one couldn't bring one's own food or one's own ice, if that's what it is. I think it's the traffic that's generated by getting those things for you on dialysis that is why people don't want you to have them, not because of anything bad about having ice.
Mm-hmm.
One other thing that I meant that I didn't mention earlier when I did my little spiel at the beginning was waiting rooms, and it relates to what Dr. Levin just said. waiting rooms are a sort of a concern. As you know, well, you people in this call know better than I do, but hemodialysis waiting rooms are, great places for interchange of information. Relatives, patients meet each other, become very friendly, or all sorts of interchange, and they're often busy and crowded. And of course, everybody who's worried about transmission worries about them. So again, I hate to say this, but I would be so careful in a waiting room. You've got to keep your distance, and it's sometimes not possible. And some of the units are making plans around that. One unit I know has people wait in the car park because it's close by, and they call them in on a cell phone. And others have more staggered starts and so on. But don't, it's terrible to say this, because the social support people get in hemodialysis from the waiting room is often helpful, not just for the patient, but for the spouse or whoever is helping. But it's just not a good idea right now.
Yeah, and just to add to that, visitors in the dialysis unit, unless they're essential for care of the person on dialysis due to, behavioral or cognitive or other reasons, is also forbidden. So that's another change that we've made. Again, to Peter's point about the social isolation, it's even the dialysis unit is a little bit more barren. And I know the waiting room, that's one of the reasons for staggering people's starts and trying to make sure that there's a lot of distancing and waiting your cars until you're called and things like that. And these are all big changes, and they won't go away anytime soon. I think that's sort of partly really important for us to support each other in this new normal, which will not go away for at least, and I think it's important for us to be honest, like at least 6 months, because flu season is coming in the fall. So whatever we do now will have to be repeated again. So, and we won't have a vaccine before then. So this is at least another 6 months of something that looks a lot like this. And that may be important for all of us to get our minds around.
Dear, I see a question here that is a heartbreaking question from one of the people. It says, it was reported this morning that social distancing could last for years. Will that mean we won't be able to kiss or hug our children or grandchildren for years? And I'm an optimist. I don't think it's going to go on for years. I may be wrong, but I think it will go on for some months. Just to be clear, the risk is far bigger to the grandparent than the child. The general experience so far is this is a very mild disease, often no symptoms in children. The trouble is children could in theory be a vector and carry the disease to grandpa, who may have kidney failure, heart disease, diabetes, and something else. So it's a very difficult one. Again, we're social beings, and some things are very, very important. And
I guess just to add to that, I think the whole notion of physical distancing is a lot to do with strangers and not knowing where they are and what they've contacted. And so people are talking about, creating safe units of families. And so perhaps, if people haven't gone to school and they're still around, I wouldn't think that we couldn't hug our children and our grandchildren, so long as everyone was safe about it and everybody washes their hands and no one with a slippery nose comes towards you. And I think there's a lot of hope for the vaccine, as Pierre alluded to, that sometime in the next 12 to 18 months, if there is a vaccine, then that will also be very helpful. And I think the more I know people who have grandchildren, and basically what they've done is they self-isolate. So they don't see anyone other than their children and the baby. And so they have created a unit that everyone is sure that everyone else is safe. Now, is there data to support that? No, but the theory is that if you're quite sure that you've been in no contact with anybody and you're very clean and strict, then creating those bubbles of safe groups of people, especially your family, may be the way that we get through this, so that we don't have to be devoid of human touch.
I can't help noticing another question. I'm surprised Lydia didn't direct it to Dr. Levin or Dr. Brown, about how does social distancing affect sexual relationships? So, that sort of follows through from the hugs. I'm trying to be a bit lighthearted here, but it's an interesting question. Obviously, you should limit it to the people that you're in, that you're quarantining with. Preferably not in the dialysis unit.
Promiscuity is not recommended at this time.
But
yeah, I mean, sex with your known partner is not a problem.
Having said that, there are, I think, and I'm hearing this from doctors as well as patients, that when they come home in the evening, their family don't necessarily want to jump and hug them either. The dog, yes, but the rest of the family are not so keen about that sort of interaction. So I don't know what really to say to that one. But if you're quarantining with somebody, in theory, you're both in the same quarantine. But obviously, dialysis patient is coming from a hospital, and there may be situations, if this is relevant, where the usual partner may not be so keen, and it may relate to this. So Pierre, you're
like everyone. Yeah, I mean, Pierre, we're all gowning and gloving to see patients. We're as safe as we can be. We're changing our clothes and coming home, and then we're having a shower. So, yeah.
I think that's the key message. I think ultimately the evidence shows that if someone in the family becomes infected, so not necessarily brings it home on a piece of clothing, but becomes infected, then pretty much everybody in a household is likely to get it. I think that there is a question there in terms of sexual activity if your partner works in a hospital, if your partner's on dialysis and comes home. So I think it's important we're all taking precautions at the hospitals. I think that when you come home, we've heard about it. If you can, just simply change, take a shower. After that, I think that the people you're living with are your social circle. They will be in contact with you. And so sexual activity in of itself will not increase the transmission more than living with these people.
Some really good points. Thank you for that. And knowing that we are going to be holding a specific webinar on COVID-19 and transplantation, I'm not going to delve too deeply in the number of transplant questions that we've had today. However, I just wanted to clarify a few items with Dr. Brown, if we could, about the impact of COVID patients waiting for a transplant, particularly if they're highly sensitized, and whether patients should consider stopping dialysis if an organ does become available at this time.
Mm-hmm. So I think I can't get into the specifics because ultimately there are some variations across the country, but general rule of thumb is that for very, very highly sensitized patients, we recognize that the chance of getting a suitable and compatible kidney is a bit lower. And so there's a certain cutoff that changes in some provinces. But I think that if you are offered a kidney at this time, if it's still going ahead, it means that your team has decided that the benefit to you is greater than the risk. And then you should proceed with that offer as you would any other time. We've taken extraordinary precautions in the hospitals. As Dr. Blake alluded to, nothing is risk-free, nothing in society is risk-free. So it's always a balance of risk and benefit. And so for the few patients over the next few months who may get offered an organ, I think that you always want to think about your options, but that if you're offered an organ, it's because your team really feels that this is in your best interest. I think I also wanted to switch gears in a brief second and maybe just touch back, because I think it is a challenge for a lot of patients. There was a question about drive-through restaurants and takeout, realizing that some of you folks really rely on this as an important means to putting food on the table. So in a nutshell, it's a yellow activity in the sense that green would be taking a walk in the park and distancing from everyone, and red would be being close proximity to strangers. So it's something that if you can avoid restaurants and takeout right now, it's probably best to. But if you can't, because you rely on this to feed yourself, it's relatively safe. careful. And the important thing is, as soon as you come home, you bring the food home. It's recommended maybe to plate it into your own dishes, and then before you start eating, immediately wash your hands. And that will minimize your risk. Nothing is risk-free, but so if you can avoid it, but if not, then it's relatively safe.
Yeah. And remember, I think, to go back to some of the facts, is that the droplets don't live very well on cardboard and stuff
Right.
like that. It's metal surfaces.
Right.
Right. So that's why when you're in a cubicle or at a desk or at a computer, it's kind of important to make sure that's super clear.
It's really good to know. And I might address this question at you, Dr. Levin, about people on clinical trials or experimental trials of medications. Is there any risk of continuing the pills, even though they can't do monthly blood testing at the moment?
So I would actually challenge, there's no reason why you can't do monthly blood testing. Outpatient labs are still open and they have taken all the precautions. So what Pierre was talking about, we have reduced the non-essential blood work in outpatients where it's safe to do so. If you're on, many trials have been halted or readjusted. I saw one question about a drug that is not you're not in a trial, but you're on a medicine that requires monthly blood work for monitoring. If it's possible for you to get the monthly blood work, I would continue with it. Remember that all the laboratory outpatients all wipe down the surfaces between patients. They're wearing masks. They're doing everything right. If you can't get monthly blood work because in your area that isn't available, then you might talk to your doctor about the risk and benefit of staying on that medicine without a blood test. So I hope I've answered it well enough. In BC, we've actually made sure that the outpatient labs appreciate that people with kidney disease, transplants, people with cancer, and people on home dialysis do require blood work to be done as part of their monitoring to avoid them coming to the hospital. And so the outpatient labs have done a very good job of guaranteeing that service. So I would imagine that most of the provinces have a similar approach. So
yeah, it's very similar here. And although some smaller location and branches have closed, which has put a bit of hardship on patients who live in more remote communities, I think you've answered it properly. I have many patients who have to have monthly blood tests, and if they're not sure, I've encouraged them to contact my office so I can guide them based on their condition, should they stop a medication versus continue with labs. But I think by far and large, going for important blood and urine tests is very safe and is also very important for your health. I think that we must realize that unfortunately, despite this pandemic, health and diseases, other health and diseases do not stop. And so we have to provide all of you with treatments and surveillance and therapies for your underlying conditions such as diabetes or high blood pressure or kidney disease. And we can't also fall into the trap of stopping everything because we don't want any of you to suffer adverse health consequences because we're putting monitoring of important things on hold.
yeah, that's really key. Our job is to keep you safe and not COVID positive, but not to forsake or compromise your chronic care for COVID. And I think that that's what our commitment is. And so all of these things that we're talking about are to ensure that.
Thank you very much. I'm just going to finish up with a couple more questions before we close up for the session. It's been an extremely popular session. We had a question earlier, how many people had attended. We were close to 550 attendees at one stage. So for us, it's been a really wonderful attendance and a lot of people coming. We will endeavour to answer your questions as much as we can and try and circle back to some of those questions if we can afterwards as well. But feel free to contact us at our contact email, which will come up on the screen shortly if you do have any other specific questions after the webinar. But I've had a couple of questions in regards also to medication and using alternative therapies, and a lot of hype on social media about things such as tonic water for COVID-19, and using some medications for lupus for COVID-19. And we just wanted to find out if there were any truth to using these medications or using tonic water, and are there any specific warnings for people on dialysis about that?
Can I make a comment, because I had a personal experience with this with one of my patients? Please don't use the lupus medicines. My patient ran out, like she can't get her meds. So there are lots of hypes and there's lots of stories going around, and there are clinical trials being conducted. But please don't use medicines that have not been approved, because people that have them for diseases for which they work now can't get them because of some of this hype. And to be honest, everything that you're hearing, all the personal, lovely things that people think are working, if they were, they would have been used a long time ago. So at the moment, nothing that we're aware of is for uptake. There are some trials with antiretrovirals. There's some trials with hydrochloroquine. There's some trials with some other newer agents. None of them are finished yet, and so to my knowledge, there aren't any magic cures. But please don't use things that other people need for their other disease, because that broke my heart when I had to have her dose.
I'll make a quick comment as well. Remember as well, if you have kidney conditions, especially if you have end-stage dialysis-dependent kidney failure, these medications are much more likely to have side effects than they are in somebody who's normal kidney function, because they accumulate. So not alone are you depriving maybe other people of a medicine they need, but you may be putting yourself at risk, more risk than the general population, by taking a medicine. We've over the years had various alternative herbal medicines that have caused problems specifically to people with kidney failure. So it's just a word of caution. Be careful. We all need to be careful with meds, but people who have kidney conditions need to be especially careful. And there are a lot of scoundrels out there who'll try and sell you cures and this and that. So far, there seems to be nothing proven, but lots of trials, as Dr. Levin said.
And I will reiterate, because I just saw another question, family members who you trust and are safe, they're allowed in. And, and there's just a lot of hand washing. There won't be a lot of hugging and kissing if they've traveled to come and see you. But yes, you don't have to stay all by yourself because you're a dialysis patient, especially as a home patient.
Thank you. And I might just tie it up with two last questions. And we've had this question submitted prior to the webinar and also online. So I just thought I'd ask this one. Are there any high risks of COVID for people with minimal change disease or focal sclerosing glomerulosclerosis?
Mm-hmm. I think, again, we have to be careful and answer in broad terms, because A, it's a novel disease, and B, I don't know the individual circumstance of everyone. So I think the general rule of thumb is, if you have a disease that requires you to take medications that suppress your immune system, and you're currently taking those medications, then you want to be extra careful. You're more at risk of acquiring an infection, and probably more at risk of getting sicker, because your immune system cannot fight this off. That said, we don't know for sure. There's not enough evidence to say that just having a condition which is under control and maybe in your remote past will affect you. And so that's as far as I think we can answer that question.
That's reasonable, and thank you very much for that. And finally, we will ask the last question of today, and if there is any difference between pediatric dialysis patients and adult patients that we need to consider.
Not sure you're asking the right group of people.
No, we have no pediatric nephrologists here. So I guess the final question then is mainly about whether there will be any changes to dialysis in the future. And it would be great to have a crystal ball. I know we don't have one, but just I guess it would be nice to hear your opinion on that moving forward into the future with COVID and dialysis.
I'll start, and maybe all three of us can answer. I think we may learn how to both increase the physical distancing and virtual visits, but improve some of the personalization of care because of that. We may change the way we do shifts and reduce the large cohorting in the waiting room, which on the one hand is very social, but maybe groups of 5 instead of groups of 30 are better and kinder, and also more likely to reduce spread of things. I think there's lots of different ways that will probably increase our use of home-based therapies because of this, for good, which is a good thing. And therefore have to figure out other ways to improve socialization. There's a lot of things for us to learn. So I'll stop there and pass it over to Pierre.
Yeah, so I think none of us have a crystal ball, and certainly at this time, it's hard to predict the future, but I think things that will change is that the current peak will improve. I think we're already seeing that because Canada has been so responsive and responsible, cases have not skyrocketed like other countries. And I think that allows our healthcare system to build up not only capacity to treat those that get sick, but also more widespread and available testing. And you see in the news that more and more, there's more testing, there's going to be more rapid testing. And I think that once we have that, we'll be better equipped to test healthcare workers, test patients who may be asymptomatic, so that we don't have to be as restrictive in the social distancing. Does it mean that we're going to get back to normal? No. But I think there'll be a semi-normal until we get back to normal. So I think that's the other hope, is that while a true vaccine and immunity of the masses is many, many months away, better testing and isolating of those who carry the virus is not that far away.
My little thought is that maybe a year or two from now, how will this have changed things? I'm wondering, in Canada, maybe more than in other countries, we do a lot of our chronic hemodialysis inside acute care hospitals. There's some nice things about that. It's certainly convenient for doctors, but it may not be the safest place. In other countries, and may vary by province, there's a lot more shopping mall-based, strip mall-based, dialysis units. And maybe that's healthier than having it inside a hospital during an infection like this. Just a thought.
Thank you very much. And, we've had an extraordinary amount of participation today, a number of participants and questions that still keep on coming. And, as much as we would love to answer them all today, we are limited with time. However, if you do have further questions, feel free to contact us, and Janice will shortly put on the screen how to contact us and where to contact us, and we can definitely speak to our panelists, speak to our partners in dialysis and our branches to see if there's any way and how we can help you further with your specific questions. But today we would really like to thank our speakers for giving up their time and being so informative and being able to jump from one topic to another so easily. We'd like to also thank the Canadian Society of Nephrology for partnering with us to share this important information today. The Canadian Society of Nephrology is a society of physicians and scientists specialising in the care of people with kidney disease and in research related to kidney and kidney disease. Their vision is that all Canadians with or at risk of kidney disease will receive optimal patient-centred care and achieve best outcomes. They have been working to develop COVID-19 guidance documents to help ensure that we continue to deliver the best possible care during these difficult times. And the Kidney Foundation is committed to providing information and educational resources about kidneys and kidney disease. We distribute books and brochures to anybody diagnosed with kidney disease. Our patient handbooks provide information about treatment options, diet and lifestyle, and are specifically designed for people living with kidney disease. Even with all the resources available through hospitals and kidney care teams, patients can find themselves overwhelmed by the information, and it can be difficult to find answers to all their questions and the issues they may be facing. Through our regional branch offices, we offer advice and support about accessing services within the healthcare system, assisting people to access other supports in their community, and offering assistance in skills for self-advocacy. We invite you to connect with us if you have further questions, to speak to someone in your community, or to access further education materials and resources.
Thank you everyone for attending this webinar, COVID-19 and Dialysis Patients, Your Questions Answered. And there certainly were lots of questions and lots of answers. Once you leave the webinar, you will receive a follow-up email that includes a link to our satisfaction survey. Your feedback is important to help us improve our webinar series, so we appreciate if you will take a moment to complete it. You will also receive a follow-up email within 24 to 48 hours with a link to view the on-demand recording of today's webinar. On behalf of the Kidney Foundation of Canada, the Canadian Society of Nephrology, and our presenters, thank you for joining us today. Stay well and enjoy the rest of your day.